Okay, good afternoon, everyone. Since we're running a little short on time, I want you to do one thing as we're getting settled. Hopefully you all have your attendee packet, and if you can go to the second to the last page. So I want you to have that. Everyone should also at their table have a large sheet that looks very similar to what is in your package. And you should also have a felt pen, black felt pen, which you will use to write on that sheet. And then I'm just going to call out a few names, and hopefully you'll have one of these individuals sitting at your table. If you don't, can you raise your hand? Terry Allen, raise your hand. Okay. Carla Alvarado. Ella Hottenclass, okay. Stacy Becker. Yes. Kathy Erwig, over here. Alan Gilbert. Oh, there's two of you there. Okay, just hold on. Gerther, over there. Bobby here. Mary Pittman there. Pamela Russo. Okay, is there a table that didn't have someone who raised their hand? Someone missing a facilitator? Over there? Okay. Okay, I think everybody has a... Or join another table. Okay, as Bobby mentioned this morning, the way this workshop was organized was to really sort of give some of us a beginning understanding about tax policies and strategies and how to use them to finance population health, to better understand them, to be able to assess them, to be able to think about them, and perhaps to even develop them. And so what we're going to do now is to test our knowledge to see how much we've learned since this morning. So this group exercise is to engage you in considering how you and your table mates would create a tax policy to support a state wellness fund. And this is for Ourlandia, the Ourlandia Wellness Fund, which Stacy referred to earlier. Okay, so you live in the beautiful state of Ourlandia. Your governor is concerned about the health and well-being of the residents and the implications on the business development and economic growth of the state. And she wants to invest in that diversified portfolio of interventions, which address not only health, but determinants of health, preventive care, and the delivery system reforms. And so she is interested in participating in this statewide wellness fund. Okay, so $25 million needs to be raised by the state to match the contributions from the private sector. So Ourlandia has already received very generous contributions from the California Endowment, RWJ, Kresge, all the hospitals in the area, and the largest insurers in the state. So the governor recognizes that the wellness fund could deliver much better value, greater value, if the taxpayers and government officials were also invested in its success. So the governor has asked you to design a tax policy to fulfill this opportunity. Okay, this is just a little bit of background information. That should be in the tables behind that sheet that I pointed to you before, so you have it in helping you with your thinking about what you can do. So the state budget is $35 billion, and part of the state general fund is $14 billion. It has sources of revenue that come from, let's say the majority of them coming from sale and gross receipts at 41%, and the state income tax at 45%. There are some sin taxes. You have a cigarette tax, and you have a tax on liquor by the drink. And these are some of your key budget expenses. 32% is going towards education, 35% to Medicaid, and 33% to other spending. There are some tax credits that are claimed, the usuals, and then the total health care spending is at $49 billion, and you have a nice graph there. Okay, so here's your instructions. So first of all, you have to pick someone who will be the scribe and the potential reporter of the work that you do. Your facilitator, who you now know who that individual is at your table, will help you with facilitating the discussion and the answering of the questions that are on the sheet that we referred to earlier. You're to discuss a potential tax strategy, whether it's a tax or a tax credit. That's up to you. And you're to come to a friendly consensus, so no fistfights. We understand that you may not have the perfect answer, so that's okay. And we will ask you to summarize your strategy in the sheet that you have in front of you. And then we'll be calling on some of you to discuss those with the larger group once we're done. And then that's just a little special note for our experts to hold back if you can. Yep. Find the money. 25 million? That's up to you. I'm sorry? Yes, okay. Maggie, can you raise your hand? Oh, okay. So Maggie's going to be walking around and just sort of keeping tabs on the kinds of different tax strategies that you're developing, and then she'll be trying to identify those that are significantly different from each other so that we can have a variety of them discussed when we come back together. Okay, so we have until 2:45. So instead of giving you a 15-minute break, we're asking that you, if you need to take that break between now and 2:45. And then we will report back out at that time. Any questions? Okay, and we'll see you at 2:45.